Hello there. Welcome to another episode of COVID-19 Update here in Chatham-Kent, where we talk to different municipal officials, individuals, and organizations that have been supporting us through these very trying times. I'm happy to have Donald MacLellan, the General Manager of Chatham-Kent EMS. Donald, thanks for joining me today.
Well, thanks for having me, Eric. I really appreciate it.
So I got to ask you, how have you been doing during this very interesting time in our community, province, and the whole world for that matter?
Yeah, so we've certainly our lives and the way we go about our business every day has changed somewhat significantly since March 10th. I'm really proud of my team here. They have been committed to adjusting the way we go about our business in ways that protects themselves and our patients and the family of patients. And at the same time, still providing that high level of care that the community expects us to deliver day in, day out. So it's been some challenging times, but they've done an amazing job of keeping up with updates and changes. Early on, there was changes almost every hour. So really proud of the commitment and dedication that the paramedic staff here have demonstrated during this time. We've also, we want to really appreciate the community, that we've received a lot of words of encouragement and thank yous and donations of, food and various other items to show their appreciation. And we're very grateful for that. We get into this business and line of work because we love what we do and we love to care for people, but getting that sort of extra, encouragement is really, truly appreciated. And then we want to thank the community. They've been doing their part in all of this, to help ensure that they're protecting themselves. They're following public health measures, and they're working patiently with our paramedic teams as they respond to calls in the community.
Yeah, it's been a very interesting perspective seeing all of our emergency services doing what they're doing from the front line. And you're kind of the last one. And I know, again, all of you guys have been super busy. So what kind of service calls have been kind of increasing? I know like in the fire team, it was open, our fire bans were done, whether the police, it could be just normal routine. What has the EMS side seen differently during entirely through COVID?
Well, early on in the pandemic, we actually had a decrease in our call volume. So, I'm sure people were very cautious in when to call 911 and when to utilize emergency services, as well as the emergency department. So, we did see a dip in call volume early on. But as things have started to reopen, and I think everyone's comfort level with COVID-19 and the understanding of the protective measures, our volume has gone back up. We have seen some increased calls in the mental health related discipline. Opiate overdoses have increased as well. So we're working very closely with public health and other community partners to really keep an eye on that, to ensure we understand that trend and understand what our response should be to that. So, unfortunately, we don't like to hear that those call volume numbers do increase, but they have. But we've been working very closely with our partners and doing our best to approach that as a community rather than individual organizations.
Yeah, no, it's you kind of touch base on the mental health perspective that a lot of people have been going through some interesting hardships during this time, and kind of segues to the next question with safety precautions being put into place for the safety of your team, obviously. Has there been kind of a difficult transition that you may encounter somebody who said, I'm not sure if I have COVID? What kind of things do you guys have to do, kind of a step by step as you kind of move forward?
Yeah, so there's really two approaches to that. So every 911 call that requires medical assistance, our communication center has a series of questions that they will ask the caller, whether it be a patient or a family or a third party caller calling in, to get a sense of, is there suspected symptoms that the patient is presenting with, that the paramedics would be provided a heads up notice on that so they can mentally prepare, as well as, putting on the appropriate equipment to go into a call, a residence, a location. But then we also add another layer to that approach. We then ask additional series of questions to ensure that the paramedics clinically understand what's going on in the situation, and that will help dictate if additional equipment is required, and to ensure that everyone is protected properly. Because again, our equipment not only protects the paramedics, but it also protects the family and the patient themselves. I guess it's a good time to remind people that when asked those questions, we need we need honesty, we need accuracy, so that everyone can make the right, safe decisions that is protective to everybody in that moment in time. So, early on, we did see some situations where that was not the case. Everyone was, we appreciate everybody's scared and anxious with what was going on. But the more information we have, the better decision we can make that's in the best interest of the patient and their loved ones.
Yeah, we appreciate everything the frontline staff you guys have been doing. It's definitely been an interesting couple months, but we're slowly seeing a dim light at the end of the tunnel. So one of the things I've been asking some of the teams is obviously there's been a lot of hardships, but there has to be some good news stories coming from these interesting times. Do you have any that you'd like to kind of share?
Yeah, so again, I do echo the fact that our staff have been amazing through all of this, really adjusting with the changes as they come up. Very open to new ideas, new suggestions. So it's been really great in that sense. The community partnerships, especially with the healthcare partners, have been outstanding. I've said this many times to many people. Chatham-Kent is very fortunate to have a very close working relationship among all the healthcare system partners to make solutions work in this community to support patients and ensure that they get the highest level of care possible. So things like the partnership with CKHA, Public Health, ourselves going into long-term care retirement homes, doing some testing there. We have a great story to tell. Those results have come back 100% negative. Some communities and jurisdictions in the province don't have the same story to tell. So we're very fortunate that Public Health took some very high-level actions early on in the pandemic, which I think these test results were as a result of those measures that were taken early on. The other partnerships, doing the mobile clinics throughout the community. We did Wallaceburg a few weeks ago. The number of tests that were performed exceeded our expectations, which is a great story to tell. To which that demonstrated that we could take that show on the road and go elsewhere. So we have clinics coming up in Tilbury, Blenheim, and Thamesville over the next few weeks. So we really encourage the public to get out and utilize those clinics if they do feel that they have symptoms of COVID or suspected to have COVID. We really want to, the whole point of these clinics is to get out there and to really provide access to care throughout the entire municipality and try and provide, equal opportunities no matter where they live in the municipality. So, but yeah, overall, then the outpour of support from the community. We cannot thank them enough for everything that they've done to demonstrate their appreciation for the work that the paramedics do, as well as other healthcare providers and first responders in that community. So, yeah, we're great and appreciative to work in the community that we do work in.
We have a great community, and all the resources that were put into place from our senior levels of government, even down here to our local government. I think we've gotten through a good majority of this, but obviously it's not the end of it yet, and we still have a long way to go. But thanks for what you guys have been doing to keep everyone safe. And Donald, is there anything else that you would like to add as we close out?
Yeah, just back to the staff piece. I just can't thank them enough. They're the ones on the front line doing the work day in, day out, whether it be on our land ambulance operations side or on our community paramedic side. They've been great troopers through all this, and they do great work. Pre-COVID, amazing work, but they truly demonstrated their ability to transition and adjust on the fly as this did unfold. And we've got some good lessons learned here, and we're prepared for what could come next. We're hoping not a wave two, but if there is, then we've got the partnerships, we've got the lessons learned, we've got the plan, the playbook done. It's just a matter of tweaking it to adjust to what needs to be adjusted in that moment in time. So
yeah, let's hope all of our pieces are staying in place and we can continue to fight the good fight. And I hope when this is all said and done, Chatham-Kent can have one big giant block party to celebrate all the hardships endured, because I think we all definitely deserve it.
Absolutely, so we appreciate everything you guys do. Everyone plays a role in this. You guys are great, promoting certain messages. Obviously, sharing the good news stories from all the organizations. So again, whether you're in healthcare or communications, everyone has a big role to play in all this, and they've done a fantastic job throughout it.
Let's keep working together. Thanks again for your time today, Donald.
Awesome. Take care.